everyone, I am Johaira Galalgiaman from BSN 111F. So now, I am going to perform hand washing procedure for our hand hygiene. Hand washing is the most effective way to prevent the spread of microorganisms. Hand washing reduces the number of microorganisms on the hands, reduce the risk of transmission of microorganisms to the clients, reducing the risk of cross-contamination among clients, and reduce the risk of transmission of infectious organisms to oneself. These are the equipment that we need for our hand washing. Liquid or bar soap, tissue or paper towel, sink with running water. These are the preparation before we perform hand washing. We need to assess our hands. Our nails should be kept short. Short and natural nails are less likely to harbor microorganisms, scratch a client, or puncture gloves. Second, removal of jewelry is recommended. Microorganisms can be lodged in the setting of jewelry and under the rings. Removal facilitates proper cleaning of the hands and arms. Lastly, check hands for breaks in the skin, such as hangnails or cuts. A nurse who has open sore may require a work assignment with decreased risk for transmission of infectious organisms due to the chance of acquiring or passing on an infection. That's all for the assessment of the hands, and now let's proceed to the procedure on how we perform proper hand washing. So the first step is to stand in front of the sink. Do not allow your uniform to touch the sink during washing procedure. The sink is considered contaminated and our uniform may carry organisms from place to place. Then remove our jewelry. Remove our jewelry facilitates proper cleansing. And the next one is turn on water and adjust the force. Water splashed from the contaminated sink will contaminate our uniform. Adjust the flow so that the water is warm. Warm water removes less of the protective oil of the skin than hot water. Next is wet the hands from wrist area, pointing fingers toward the bottom of the sink. The water should flow from the cleaner area toward the more contaminated area. Our hands is the more contaminated area. And then, the next one is use bar soap or liquid soap, lather thoroughly with bar soap. And then rinse the bar soap and return to soap dish. Rinsing the soap removes the lather that may contain microorganisms. And then, thoroughly wash and rinse the hands. Use firm rubbing and circular movement to wash the palm, back, and wrist of each hand. And we will washing our palms in circular manner. And then, the right palm over left dorsum with interlaced fingers and vice versa. Clear up it, and then to the other hand. And then next one is palm to palm with fingers interlaced. And then box of fingers to opposing palms with fingers interlocked. Left fingers clubs in right palm and vice versa. The circular action creates friction that helps microorganisms mechanically. Then continue this reaction. Continue this friction motion from about 30 seconds. Length of hand washing is determined by degree of contamination. And then, use fingernails of other hand to clean under fingernails of the other hand. Organisms can lodge and remain under the nails where they can grow and be spread to others. Then after that, rotational rubbing of the wrist of our both hands. And then rinse thoroughly, visually inspect for remaining dirt or soap. Running water rinses organisms and dirt into the sink. And then, next one is dry hands and wrists with tissue or the paper towel. Drying the skin will prevent chopping. And then, disregard the paper towel to the trash bin. I'll use another tissue to dry my hands. And then the next one is use a new paper towel or tissue to turn off the faucet. This prevents from picking up microorganisms from the faucet handles. And then disregard the paper towels to the trash bin. Always remember the 5 moments of hand hygiene or when you perform hand washing. First, before touching a patient. Second, before clean or aseptic procedure. Third, after body exposure risk. Fourth, after touching patient. And lastly, after touching a patient's surroundings. That's all for our hand washing procedures. Thank you.